Hello and welcome to the Restructured Health Services channel. I am Carlos Cruz, a bodyworker slash acupuncturist slash structural integrationist here in the Pacific Northwest, mainly in Portland. And this video I'm going to try discussing a little bit about structural integration. So most people have heard of structural integration maybe in different terms. Some of the more famous brand names are usually like Rolfing or Hellerwork, and all that is to say is just the brand. It's a different school. There's a bunch of different schools. It all kind of started with Ida Rolf of Rolfing fame. She actually started the Guild of Structural Integration, and then soon after that, they kind of started like the Rolfing program. And after she passed, a lot of her students kind of broke off, started their own schools. And I actually trained under the Soma Neuromuscular Integration up in Washington. So it kind of just depends where the structural integration is trained. Each one will have a different flavor. Some of the students broke off. They kind of added their own little things here and there. But overall, structural integration is a little bit different than your basic massage. So when we're talking about structural integration, it usually consists of a series of sessions. Depending on the school, that can vary depending 10 to 12 sessions. In contrast to general massage, when someone goes to see a massage therapist, if they're not looking for like a relaxation type of bodywork massage, they're typically, in most cases, they're going to be focusing on one area. There's going to be a problem area. Most people are coming in for neck pain, back pain, shoulder pain, etc., etc. Structural integration is a little bit different. So instead of like focusing on one area, we're looking at the whole, the holistic approach, working on the whole body. And to do that, they kind of break the body into pieces. You're working on the whole body over a series of sessions. So typically each session of the series is going to be predetermined. Session 1 is typically going to be session 1. No matter who I'm working on, session 2 is always going to be session 2, no matter who I work on. In future videos, I kind of break down, at least in my series, what those sessions will contain. But in general, when I'm working on a particular session, there's going to be a particular focus, a particular goal. And then throughout the whole series, we're trying to work on the body over those sessions. So in all, the end goal would be kind of a reset, where if you look at the original images of structural integration, Rolfing, it tends to be all about alignment, trying to stack the person, a more balanced structure. We use other terms like levity, so it's trying to create space in the whole structure, this tensegrity, this way that the body is held together to allow for more ease. For me, that's kind of shifted over the years that I've started to do this work. But I still find that the series can be very helpful for people with a lot of chronic issues, especially if it's not just one area that they're having problems with. So say someone's having back pain. That may be the most chronic issue, the most problematic issue, the thing that they're feeling the most. But at the same time, they may be having other underlying issues as well. Knee pain, ankle pain, shoulder pain, neck pain, so on and so forth. Especially in these people, especially with chronic issues, it might be a better path to work over the whole system. Again, when we're looking at regular massage therapy, most people who typically have some chronic issues will generally see a medical provider of some sort, not necessarily a massage therapist, but chiropractor, acupuncturist, and they'll tend to get treatment on that specific area. So every time you go see a massage therapist, You're always going to work on your back, always focusing on the back. And that tends to work, but what tends to happen is those chronic areas continue to be chronic areas. Number one, basically, these places will tend to have more injury or be prone to more injury. And again, I'll probably discuss it in future videos. If you never really work on the area and then just getting superficial treatment, you're never getting into the deep structures, it may be hard to have prolonged benefit from these treatments. But when we're working with these chronic areas all the time, you tend to miss other things that may be connected. So in the example that I used before, yes, somebody has back pain, but then they have to have knee pain. They may have knee pain or some joint issues in the ankle, some issues there with their feet, and especially in that particular scenario, those three areas, the hip, the knee, and the ankle, tend to have a lot going on with each other. And usually in these cases, when one of those areas is having issues, the other two will generally jump in. And from the structural integration perspective, sometimes if those areas are never treated, there may be some underlying issue. You fix the hip, but then those underlying issues in the knee or the ankle will prolong or tend to misbalance any work that is done on the hip. So the structural integration perspective over time tries to work on these chronic issues. Now, one thing for me, I'm not really looking at necessarily balance, but in most cases, people who have had chronic issues their whole time, they never really find what non-pain feels like or movement in some areas. And over time, these areas become really constricted and the tissue actually changes. So for me, I really think that structural integration series is all about kind of resetting the body. Maybe it's been years since they've had pain, and especially for us in Soma, we have the Soma massage, which gives people a good introduction to what their body will feel like. And especially in these cases with chronic issues, it might not last, but it will give you an idea of maybe what your body would feel like if things were a little bit more aligned, if some of this tension is dealt with from a more holistic approach. So going through the series, again, we're looking at the holistic approach. Structural integration is taking that person, and instead of working on one particular issue, we're looking at the whole body, one holistic system. Much like in acupuncture, your body is not just made up of little pieces. It's not only the back and how it affects the hip or the shoulder, but how they integrate with each other, and one thing overlaps. So structural integration is a system of taking the body through a series and trying to work on these chronic issues, and maybe giving some folks some help in areas that have been long lasting. As opposed to a regular massage, this may be something that could be proved vitally helpful. So, interested in structural integration and you're in the Pacific Northwest, in the Portland area, go on and check us out here at Restructured Health Services. Me, for instance, Carlos Cruz. But be sure, if you have had regular massage, I would definitely give a structural integration a chance. See how that thing goes. See what differences you find in this type of body work. It can be very different. It's not a relaxation massage per chance, but it works. So if you're interested in more of these kind of videos, please subscribe and reach out, comments if you have any other questions. I'm going to try to make a whole series, no pun intended, in regards to this structural integration session and how I work with it. So each session, what's covered in each session. So stay tuned. please subscribe.